Good morning, everyone, and welcome to Medical Minutes, sponsored by Passavant Hospital. I'm Dr. Peter Russotto, your host and moderator. I would like to welcome back Dr. Scott Boston, a board-certified emergency room physician and the medical director of Passavant Hospital's ER. Today's topic, the acute treatment of strokes in the ER. The term stroke is also called a CVA or cerebral vascular accident. Sometimes the general population will refer to it as a brain bleed. Dr. Boston is here to educate us to why we need quick intervention for a stroke. He will also discuss some of the signs and symptoms that would guide us to seek medical attention in the emergency room ASAP. So again, I welcome Dr. Boston, and let's start with the first question. What exactly is a stroke?
Well, good morning. Good to be talking to everybody. Stroke is a sudden or acute blockage or obstruction of the blood circulation to the brain, resulting in a neurologic deficit. So a part of the brain becomes starved for blood supply, and that part of the brain stops functioning.
Aren't there really like two different types of strokes mainly?
So we break strokes up into two separate classes. There's what we call ischemic strokes, and those are the most common. We see those most frequently. These are strokes where there's a blockage in a blood vessel. This can either be because a blood clot forms in the vessel directly or a blood vessel travels from another part of the body. These ischemic strokes obstruct blood flow. The other type of stroke would be what we call hemorrhagic. Hemorrhagic strokes cause a blood vessel to burst or to open, and the blood spills out into the brain. This busted blood vessel then doesn't supply blood to the part of the brain that it was previously because the blood's spilling into the brain and not getting to the brain tissue.
That's where the general population gets that term brain bleed then.
Sure, and the hemorrhagic strokes generally are more severe. They typically have a larger number of symptoms and quite honestly are more difficult to treat.
There's quite a bit of risk factors involved for prevention of stroke. Can you touch a little bit on that?
So the common risk factors for stroke are very similar to the risk factors for coronary artery or heart disease. Classically, we think of smoking, diabetes, hypertension, hyperlipidemia, or high cholesterol. These are all factors that cause, we believe, damage to the blood vessels. Like a heart attack, a stroke is damage to the blood vessels, and so anything that causes damage to the blood vessels increases your risk of a stroke.
So what is the basic symptoms of a stroke that the general population should look for?
So it's a sudden onset. These are not slow or insidious. They don't happen over days or weeks. They happen over minutes or very, very quickly. And what you'll see is what we call, the medical community calls it a focal neurologic deficit. So you will suddenly lose sensation. You'll suddenly lose strength. And it's usually on one half of your body. So either the left or the right side will suddenly become weak or lose sensation. People will often notice it in their face. One half of the face will droop, or one half of the face will appear weak. The other thing that we see a lot of is people will have difficulty speaking. They won't be able to say the right word or find the right word to say, or they'll sound like they're possibly intoxicated. Their words are slurred, and they can't enunciate properly. And these would be very sudden changes. They wouldn't be very slow or gradual.
How about a severe headache?
Headache is more common when a hemorrhagic stroke occurs. Honestly, most of the time for ischemic strokes, there is not a headache associated with that.
And when you talked about one side of the body having some weakness or numbness, is it the whole side of the body, or it could be just the upper extremity or just the lower extremity, or a combination of both?
Yes, the pattern of strokes depends on which blood vessel in the brain has been occluded. So depending on which part of the brain has lost blood supply, you'll get a different constellation of symptoms. Oftentimes, if you have weakness in the face, you'll have weakness in the arm as well. There are other strokes which will affect your leg, and so one leg would be weaker than the other leg.
Why is it so important, though, to treat a stroke quickly?
For hemorrhagic strokes, oftentimes they require surgery. And so getting the person to a neurosurgeon as quick as possible becomes very important. The ischemic strokes, though, the way we treat them is with a medicine called TPA, which is a fibrinolytic or a clot-busting drug. The drug is designed to dissolve the clot that's obstructing the blood vessel. And our research says that the quicker this drug is given, the better the outcome. And actually, if you give the medicine too far out, too many hours after the stroke has occurred, you run the risk of causing the brain to bleed. So it's very important, if the clot-busting drug is going to be used, to be used as quickly as possible.
What time frame would you like our listening audience to sort of like remember or focus on?
So the goal would be to have any ischemic stroke treated within 3 hours. And ideally, we would like to treat it within the first 90 minutes. So from the time of onset of the stroke, we would ideally like to have the medicine given to the patient in less than 90 minutes. It is still considered by the FDA safe to give the drug out to 3 hours after the onset of the stroke. But again, the quicker, the better.
So that's why we want the general public to understand, if they see a loved one, friend, relative, or whatever having difficulty speaking, to get into the 911 system ASAP.
We would recommend that if you see somebody that has a sudden acute change of any neurologic status, that they be brought to the hospital as quickly as possible, and that is typically by calling 911.
In your opinion, it would be better to call 911 than to drive them, correct? In most instances, I would say.
That would be the standard of care would be to come in by paramedic care through the 911 system.
Aren't there some other medical pathologies that can mimic, like Bell's palsy, other things like that might, or even a diabetic problem can cause and mimic something like a stroke?
Sure, there are other conditions, there are other stroke mimics. When people take too much insulin and their blood sugar drops too low and they get hypoglycemia, oftentimes these patients can have neurological deficits. And if they've gotten to the point where their blood sugar is so low, they probably need to be seen in the emergency room anyway. So it's a good idea to get these people to the hospital quickly as well. Bell's palsy is also a condition that you can see. It's a little bit tricky for the layperson to determine the difference between a stroke and a Bell's palsy. So you're never wrong by coming to the emergency room to get that diagnosis made.
Yeah, that's a good point. You're never wrong. I mean, it would be great to say it's a Bell's palsy as opposed to a stroke. So I don't want the general public to think, well, I don't want to bother anybody if it's just a palsy, so to speak.
Sure. You know, we'd love to be able to tell people it's not a stroke, so there's nothing wrong with coming in and getting checked out.
What are some of the new advancements in stroke care right now?
So the intra-arterial treatment of stroke has really advanced in the last few years, and there was a recent conference by the International Stroke Committee which published multiple studies that indicated by clot retrieval we can improve the outcome for a subset of people who are having strokes. So if the stroke involves one of the larger arteries, one of the larger cerebral arteries, we can actually use a small stent which goes through an artery up into the brain. Using that stent, you can retrieve the clot and pull it out. The idea is this would resupply the blood and the oxygen that the brain needs to function. And the studies look very, very promising, and the individuals that are candidates for this procedure have a dramatically improved outcome.
I know when you spoke to the medical staff just recently, you talked about the hospitals in the state of Illinois being somewhat like certified for treatment of stroke. Isn't Passavant didn't they just get that certification? Yeah,
the state of Illinois, through the Illinois Department of Public Health, categorizes hospitals at two levels. There is the comprehensive stroke centers, which provide the interventional arterial treatments. They have the very advanced stroke care. There's the emergent stroke ready hospitals, which Passavant was given that designation in January of this year, which are capable of providing the acute treatment, the thrombolytic therapy, and then making arrangements to get them to a definitive location for definitive care.
So definitely then we follow the state mandated or state-of-the-art protocols for CVA treatment.
We're meeting all the state requirements, and I would suggest we probably are above and beyond what the state requires to provide state-of-the-art care for strokes.
Say a person does have a stroke-like symptom, what should they do or their family members or friends do?
I would say if you feel like you're having a stroke or a family member's having a stroke, the best thing is to get on the phone, call 911, have the paramedics come out and bring you to the emergency room for evaluation.
In the general population, and it's out there in the medical literature, and it's also in public service things where when somebody's having a heart attack, they recommend them to maybe even chew on an aspirin. what would somebody do? Would they do that, or do you not recommend they do that?
We would hold off on doing that beforehand just on the chance that it's a hemorrhagic stroke. In those patients, an aspirin is not terribly detrimental, but it certainly is not beneficial. In the ischemic stroke, the aspirin is beneficial, but we would prefer to make that diagnosis in the emergency room.
So what does happen in the emergency room when a patient comes in with a stroke-like symptom?
Whether they come in through triage by private vehicle or they come in through the ambulance bay with the paramedics, they'll be triaged as quickly as possible to determine if these are stroke-like symptoms. If they are, they'll be taken immediately to the CAT scanner, where they'll get a CAT scan of the brain. The importance of getting the CAT scan as quickly as possible is to determine if this is an ischemic or hemorrhagic stroke. The treatment patterns are very different. So getting the CAT scan done as fast as possible is very important. Once the CAT scan has been performed, the patient will be brought into an emergency department room where they'll be evaluated by a physician. They'll have what we call the National Institutes of Health Stroke Scale done. This is a very formal, very logical, set-out neurologic exam that gives the patient a score to determine on whether they're a candidate for the clot-busting drug TPA. If the scan shows an ischemic stroke and their score is appropriate on the National Institutes of Health Stroke Scale, then they would be administered the drug TPA to help dissolve the clot.
And then after that, transferred to a stroke center, so to speak?
Then they would be referred to a primary stroke care center. Depending on the severity of their illness, they would be transferred either by ground in an ambulance or by a helicopter.
As a emergency room physician and the medical director at Passavant, it'd be nice to educate our listening audience. It's always advantageous if they have on themselves a list of their medications and diagnosis. This helps aid in any emergent situation, correct?
Absolutely. Knowing what medicines the patient's on is imperative, and particularly in stroke. If the patient is on a blood-thinning drug such as Coumadin or Russotto or Pradaxa, these drugs actually would be contraindicated to give TPA. So we wouldn't want to make anybody worse simply because we didn't know what drugs they were taking.
I always caution all my patients, and not caution, I try to educate them, I should say, that it's always a great thing just to carry the list of their medicines, their diagnosis, and allergies. They don't have to understand it. They don't have to spell it or even speak it. But if they can have it on them, that saves time and can save lives.
Yeah, it's a very big deal. The medicine list and the allergy list is particularly important for this case, too.
Anything else you'd like to add to tell the listening audience?
I see people that have come in, they had a stroke the day before, and I'm always surprised by that. I think, if I could get one message out there today, it would be if you think you're having a stroke, if it's even crossing your mind, the best thing to do is to come in the ER and get checked out. This is a condition that time is of the essence, and the sooner you get checked out, the more likely we're going to be able to help.
Well, thank you again, Dr. Boston, for being with us, and thank you all to the listeners for listening, and